Hey guys, it's Ethan Halflight here again today. I want to talk to you about hypertension, also known as high blood pressure, and its correlation with lifestyle modification. So let's talk about the components of blood pressure. First, you have systole. That's the highest measurement, the highest number, and that is the force of blood against the arterial walls while the heart is contracting to distribute blood to your entire body. Okay? So then you have diastole. That's the force of blood against the arterial walls while the heart is relaxed, okay, in between beats. So an interesting statistic that I want you to know, 1 in every 3 adults has high blood pressure, which is very dangerous because that's the highest risk factor for heart attack, stroke, and other heart disease. So the good news is you can prevent this condition if you don't already have it, and if you do, you can control it and hopefully reverse the damage that it's already caused. Okay? So one thing you should know about hypertension is that the damage is not acute. Okay? It doesn't just happen once and you're done. Okay? The complications creep up on you and they worsen with time. So it's needless to say, it's very important to take action right now before things worsen, because you can ultimately control these conditions and reverse the damage that it's caused, hopefully. Okay? So definitely take action, because if not, you could be on your way to a life-threatening event such as a heart attack or stroke, and those often leave you with physical limitations or mental limitations that kind of complicate your life. They make it harder to live an independent lifestyle. So we want you to take action right now. Don't learn the hard way, and adhere to a healthy lifestyle modification. So some numbers that you should know about blood pressure to classify whether you have it or not. Let's talk about this. Normal, you are below 120/80. So if you've gotten your blood pressure read and you're below that, keep doing what you're doing and look for ways to improve, okay? Pre-hypertensive, you're kind of seesawing in between healthy and classified as someone who has hypertension. You're 120 to 139 over 80 to 89, okay? If you're hypertensive, you're anything over 140 over 90, okay? So what this means is if you go to the doctor, they're going to prescribe you medication or different lifestyle modifications so that you can reduce this, because you're at risk for other serious complications. So definitely take this into consideration. See a doctor if you think you might be at risk for high blood pressure, and get your blood pressure taken. All right, guys, so there's this quote by Dr. Alan Rubin that I really want to share with you guys. He says, when he has a new patient who has high blood pressure, he immediately gives them a bottle of pills. Not to take, but to drop on the floor, to pick up one by one several times a day. He says this is great for the patients to adhere to an exercise program. And I think this speaks volumes, because there's a lot of doctors that are quick to prescribe medication to their patients when proper diet and exercise can do just as good of a job, if not better, to treat high blood pressure. All right, guys, so I want to keep it simple so you can get up and get moving today. 3 steps to lowering your blood pressure. 1, adhere to a low sodium and low fat diet. Saturated fat, watch out for that. That's bad fat. You don't want that. Okay? So, I want you to limit red meat, limit the amount of salt you put on foods, and I want you to Google the DASH diet, because this is a lifelong approach to reducing your sodium intake, and I think that could be a great resource for you. Number 2, avoid any poisons in your life like tobacco, alcohol, and even excessive caffeine. That can help you reduce your blood pressure. All right, so number 3 is to add regular exercise to your life. Here's how I want you to start. So I want you to get on this walking program where you're going to walk for half a mile, and I want your time frame to be 30 minutes. So whether it's before work, on your lunch break, when you get home, whether you're walking the dogs or walking by yourself, even walking with your kids, this is a great way to get the family healthy. So 30 minutes, half a mile, and then I want you to progress to a mile in 30 minutes, and that's when you start at level 1. Okay, so you're at level 1 now. You're walking for a mile for 30 minutes. And the way you level up to level 2, 3, 4, 5, that's by shaving 2 minutes off your time. When you're at level 2, you're at a mile, 28 minutes, and so on and so forth until you get to level 7. Then you're going to add a half a mile. So you're going to be at a mile and a half for 32 minutes. That's your goal. And then to get to level 15 from there, you go for a mile and a half and you shave off 2 minutes up until you get to level 15. So that's a great way to add a workout program to your life on your own for free that will lower your blood pressure. So I want you guys to try this out and let me know in the comments below how it goes for you. Oh, I also included the link in the description to this chart, so you can download this chart and you can put it up, wherever your calendar is, wherever your keys are before the day. And I want you to mandate progress. So write your time each day and a check mark to make sure that you did it. Whether it's 2-3 times a day, that's even better. So try that out. All right, guys, that's it for today. I hope you enjoyed our video on hypertension and lifestyle modification. Let us know how it goes for you in the comments below, okay? Have a good one.